few weeks ago, I was at the Oracle Health Collaboration Forum in 2024, where I had the opportunity to connect with some of the key senior leaders at Oracle Health from Australia and around the world, as well as their customers and partners from around Australia. In this feature episode of Talking HealthTech, we focus on the conversations that I had with Oracle Health executives and leaders about eliminating healthcare barriers for children worldwide, the importance of data integration for patient care and the challenges in achieving global interoperability, how Oracle Health is localising their capabilities to meet the needs of the Australian healthcare system, and the role of AI and new tools in this transformation. Stay tuned after this episode, because in a few weeks you'll also hear another episode I recorded at the Oracle Health Collaboration Forum, where I chatted with some of their customers and partners here in Australia about the intricacies of rolling out an EMR implementation across diverse health services, standardising processes while accommodating unique workflows, and the secrets of achieving buy-in from healthcare professionals. But right now, here are some of the conversations I had with Oracle Health leaders and executives at their collaboration forum. Collaboration starts with the conversation, Team HealthTech. Let's make it happen.
My name's Shanna Adamic, and I'm the Executive Director of Oracle Health Foundation, the Director of Social Impact for Oracle, and I'm from Kansas City, Missouri.
Amazing. I've been excited to have a chat with you, Shanna, and I've been able to grab you just before you're up here on the stage while it's a little bit quieter. So tell me a little bit more about the role, firstly, you play within Oracle Health and how that fits in what brings you here to Australia.
Absolutely. I'm so passionate about healthcare, and the role that I play with Oracle is leading the Oracle Health Foundation. This is our global pediatric charity that's focused on removing barriers to healthcare for children around the world. So we're providing funds and grants for anything from a hearing aid to a liver transplant, to eyeglasses, to braces, to supporting a family just to be with their child during the care that they need and get them to the care they need. It's really extraordinary. We help one child at a time, so we know every child's name and their diagnosis. And to date, we've given out more than $50 million in grants to 19,000 children in 107 countries.
Wow, I wasn't aware of the Oracle Health Foundation and the role that it plays, and that makes sense. But why is that so important to Oracle Health? You know, if someone from the outside might think, well, EMR company. And,
sure.
How does that kind of fit in there?
I mean, absolutely. It's bridging together these two worlds. It's an intersection of technology, of healthcare, of philanthropy, of social impact, bringing this all together. And why wouldn't we help the same patients that we are trying to serve?
Yeah. It makes a lot of sense there. And I understand as well, you've got your own patient story as an individual. Tell me a little more about that.
Yeah, absolutely. It's interesting. I've done this serendipitous dance with healthcare my entire life, being passionate about it, running the foundation, and then living this healthcare journey, one that I never thought I would live so personally. Between the years of 2011 to 2017, I visited my doctor and ER specialist 109 times and kept telling them something was wrong. I had growing symptoms of hearing loss, headaches, a fuzzy vision, loss of words. I felt like I was always dizzy, and then I had extreme vertigo, and then I did lose my words. And it was finally pushing one more time to get to a doctor that I got an answer. But before then, I was being dismissed, misdiagnosed, underdiagnosed, turned away because I was a woman and it was blamed on a hormonal imbalance. And I pushed one more time. I had written down my entire journey, my entire story. I had journaled it out, and I got to that specialist, and I told him everything. And at the end of it, I said, "You're going to think I'm crazy, but I think I have a brain tumor." And he sent me to go get a brain scan, and 20 minutes later, after I had that MRI, he said, "Something is there, and it's big, and it's life-threatening." I had a 4.5 centimeter brain tumor that was benign, yet it was life-threatening because it was compressing my brainstem, and it had caused severe nerve damage. He gave me 1 year without the needed surgery. And so I went into quick action. I knew my rights as a patient. I went to get a second opinion because the care plan that I received after that wasn't one that provided a lot of hope. I got that second opinion, and I got it through social media. I took to Instagram because it was impossible to get a second opinion. And within hours of posting my story on Instagram, I got a reach out from a facial nerve reconstruction surgeon who worked for the doctors who were the experts in the United States. And it wasn't where I lived, but I was going to travel to go there. Within 2 days, I was sitting across from him, and then what they said to me was, "Shanna, this is going to be a big surgery with a big outcome." And in January 2018, I underwent a 13-hour translabyrinth craniotomy on this side of my head, 2 points, and I woke up to a new reality. I became deaf on one side. I had to learn basic mobility functions, everything from talking, walking, eating, and I had the most extreme form of the right side facial paralysis that they told me I wouldn't get back. And it was a journey that I had to push forward from that point on. I had to become my connector of health, my CEO of health, up until even this last year when I was still calling my own doctor to say, I have to have an MRI each year. This is why, this is when, this is where I have to have it, and this is who has to read my MRI. I got that MRI back and it said my brain looks beautiful, but I had to become my own connector.
I don't even know where to go from that. That's a story. It's unreal, but I mean, it's certainly a unique one, but one that I know there are thousands, hundreds of thousands, millions of people that would resonate with that feeling of, going to see the doctor 109 times and not feeling heard and reaching out to any platform they can to be able to just get an answer, because it's not through it's definitely not of enjoying the process or needing the attention. It's not getting the help. And I guess the healthcare industry, that's what it's there for. So there's obviously a huge gap that, I mean, how do we take some of those learnings or the experience that you've had to be able to then benefit more people or hopefully improve the system?
Yeah, absolutely. I mean, I always say it's so interesting that the irony is not lost on me, that I've been working for a company digitizing healthcare and I was experiencing it firsthand as a patient. It was what we needed to start this change and this transformation in healthcare, but we needed to do more, which we're doing now. And what we're doing now with the Oracle Health, this comprehensive platform from Oracle Health, I mean, we're bringing this all together so that it becomes a reality where the doctor can now look and actually interact with the patient. They're not busy looking at the computer trying to input things. The computer's going to help them. Technology is going to help them. That's not going to hinder them. It's going to empower the doctor to help make decisions fast, to keep the connection going, to be connected to other points of care the patient is following up with. It's going to make the patient feel like they are seen, they are heard, they are valued. And it's this bridge that we have so desperately needed in healthcare. And that's why I'm so excited to be a part of this. Because when I share my story, I say, this is not just mine. This is the story of every patient, every person, every doctor who has ever touched a part of healthcare and wants a more connected, intelligent healthcare system.
100%. And I would love to just dive into this conversation and go for 45 minutes, but then you're going to have to jump on the stage. And people attending today at the Oracle Health Collaboration Forum are going to be treated to you doing a keynote, I imagine, sharing some of your experiences today. Does that right?
Yeah, I'm just going to jump into it just a little bit, just share a few minutes of it. I'm really only talking for about 25 minutes, but I could go on about it forever too. And I feel like this is where I get so passionate about it and want to create that change. We're on this movement forward where we are creating change, and you can feel it, and it's going to move fast. Larry Ellison, one thing he said that really resonated with me a few months ago is he said that the future of AI innovation is going to be an extension of the intentions of the creator. And in healthcare, what we're doing is our intentions are good. We're going to change healthcare, how we're treated, and how we treat others. And so I'm excited for that. I actually to let you know, I also just launched a book called Audacious Optimism. And in it, I share my journey in health and a little bit more in the lessons learned of having that bold hope. And I like to call it gritty hope, where it's like you're at your darkest moment and how do you create action? So it's an exciting time, and it's an exciting time to be part of this revolution and this transformation that we're making in healthcare.
My name is Sam Lambson. I'm the Vice President of Interoperability at Oracle Health. My responsibilities are global product management for our interoperability solutions, which are those connectivity solutions that allow for a health system that uses the Oracle Health EMR to talk with, others outside of their own ecosystem. So labs, radiology, e-prescribing, referrals, anything that you got to do with another health system that crosses that organizational boundary is going to follow some kind of a data integration. Yeah. And those are the capabilities that our team works on.
Yeah, well, that's a big responsibility, because it's, as we're finding over the last couple of years in, the conversations globally around healthcare IT and innovation, and what we need from healthcare is more interoperability. Tell me more about why this is so important right now.
Yeah, absolutely. I mean, I can start with a story. My my partner, she became ill one day and collapsed in our living room. And she's given me permission to tell the story, but we had to rush her immediately to a clinic that had an MRI available because the emergency room was during a COVID surge, had a 4-hour wait, and it was a critical moment. And they scanned her, and they found that she had pulmonary embolisms and was critical and needed to go to the hospital. And we got to the hospital, which was in a different health system. They didn't know her. They didn't know what had happened. They didn't have access to the MRI. And even though we have all these capabilities, they just weren't there for my partner. And eventually we got everything to work, and she's fine. But it was just a moment of great crisis for me personally. And my own products were not there to help my own family, right? Yeah. And so in this role, right, it's very personal to me that wherever you go as a patient, anywhere when, within the right boundaries, your data should be there for you. And so everything I do every day when I wake up with the team is focused on making that vision a reality in all the markets that we serve.
Yeah, it's bringing it back to a personal experience, I think, can take it to a real practical level, because often I think as a globally, just in the industry, we no one can argue that we don't need to have the systems that speak to each other and better patient outcomes, but it becomes quite nebulous and like a very technical, just a technical problem to solve. But there's so much more than that, right?
Yeah, I mean, I could talk to you all day about standards development and common data sets and how the systems need to create RESTful APIs. And, we can go there, and I'm happy to go there today. But at the end of the day, that's not what really resonates with me and with the clinicians I work with, from the families that I know in my neighborhood. It's all about, when I go to my doctor, I want to reliably know that they know me. And that's only possible if we do this hard work at the technical level to make sure that these systems talk to each other.
And on that point, the technical challenge of making systems talk to each other, if it was just a matter of code and the technology, I feel like we would have solved the problem by now. So there's so much more. So, in your role from an Oracle Health side, how much more of it is just outside of the pure technology side?
Yeah, no, I mean, when you start to talk about patient data, the one of the questions that gets asked is, who owns that data? Right. So philosophically, you have to decide, is that the patient's data? Is it the health system's data? Is it the IT vendor? And each stakeholder might feel like they have some invested stake in the data and may be prone to see that as a piece of intellectual property or something like that. And those are the dynamics that exist. And you see it kind of play out in the nuanced discussions you have about, okay, what kind of data sharing rights do we have to have? What kind of privacy and security safeguards do we have to have in place? And all those discussions are important, but when you over-index on policy and procedure and things, it starts to become maybe a forced barrier rather than starting from a position of, okay, let's start from what's important, which is let's get the data in the right hands and solve the problems of privacy and everything else. So sometimes we have to work on those incentives a little bit more, and that's where regulatory frameworks come into play. And sometimes there has to be incentive, both financial and kind of penalties to push kind of the industry forward on very specific terms. If we look at meaningful use in the United States, which was all about creating like the impetus to go and share those core pieces of information, that seems to have done a really big favor to interoperability because at least everybody checks certain boxes to open up the information, make it available. And now we've got this kind of second wave effect of Commonwealth or Quality, other frameworks that are national have really genuinely created a liquidity of information that was not there.
So you do need that, seemingly like what it's shown is that, by having some of those, I guess sticks, but the requirement to do it, if not for those requirements to do that in the US, then we wouldn't be at that point here. I guess enter into Australia now, and we've got these, different challenges, or maybe it's similar challenges at a different stage. How are you seeing with that global optics that you've got, the interoperability landscape in Australia and what needs to happen here, and maybe the role that Oracle Health is playing in it too?
Yeah, absolutely. So Australia is a very interesting and neat environment because it is a little bit less mature in terms of just the adoption of electronic medical records and some of those baseline capabilities that need to exist. I mean, we've been talking to customers today who are still on paper and trying to decide, how do I get onto electronic medical record? That is not a conversation we have in other countries. But in that, they're coming into a world where these technologies are sophisticated and ready. So it's really a question of, okay, how do we leapfrog from I have paper to I have a, highly, like fluid data sharing scenario. And that's really fun because we could talk about the whole picture at once. And there's been some talk even this week about a national HIE strategy that's coming into play in Australia with a big vision. And I think that, it needs to be both that and maybe some regulations that support it, but also, now that everyone's coming onto these electronic health records, is kind of a coalition of like-minded, similarly anchored, thought leaders in this marketplace who say we have to do this for the better good, and they step forward and kind of create that environment. Because the technology is not the problem, and it's really having the coalition of the willing. And I'll give you a couple examples. I don't know if we want to just jump right into this, but it's not in Australia, but there's similar dynamics that exist in, for example, Canada, where you have this provincial level kind of ownership of data and purchasing, and then you have a lot of really independent hospitals. Well, we had 11 Oracle Health customers come together and say, we really want a connection to long-term care. And then they created eHub strategy, which actually is leveraging Oracle Health HIE as the foundational technology. And they connected all the Oracle sites and then all of these 600 sites that are long-term care, and they shared information across Oracle sites and across long-term care. And what do you know? We've added all the Meditech sites, the Epic sites, and the entire kind of province of Ontario is on solid footing when it comes to information sharing. And that was a very much ground-up effort. And I think that's the kind of momentum we need to build in Australia because, yes, we'll have some, mandates at the federal level, but really, if we can really take advantage of the technologies that a lot of these customers already have, and really focus our efforts on building these strategic, points of connectivity. Maybe it's the GP practices, maybe it's long-term care, and start with a spark, and we can really build, I think, a grassroots level interoperability.
Yeah, absolutely. Because I think we've definitely gone to the days of thinking that to have a healthcare system that's all connected, then you all need to be on the one kind of vendor, right? So it's and I don't think as patient expectations change, and even connectivity across geographical boundaries too, that's going to be a requirement. So having, I guess that's kind of the themes coming out of the collaboration forum today too, is that having those the open API strategies and the ability to connect and in the end deliver better patient care is going to be mandatory. And then so I need to let you go prepare for a session that you're doing this afternoon. Tell me a little bit more about what you'll be sharing with participants today.
Yeah. It's actually along these lines. Like let's start the conversation about how we can really build from our Oracle Health customer base a flame that can really grow to really make interoperability real. And I'm going to talk about the importance of building interoperability in three areas. One is the complete connection. So really identifying those points of connectivity where we have electronic health records stored in an electronic format and need to draw it out into a consolidated record. So whether that's our GP practices and our hospitals and some of our allied providers, and ensuring that we know where the targets are. We start to bring those together into something like an HIE platform. And then there's kind of this concept of complete data sets and, the APIs that support those data sets. So how do we advance as quickly as possible the Australian core data for interoperability, the core FHIR standard, the integration capabilities so that everybody's kind of talking in the same language in this HIT community. And then finally, it's not a problem today because the data is just simply not flowing as much as we have in other places, but it will become a problem when there's so much data that it's duplicated everywhere, it's repeated everywhere, and we got to think about usability for the clinician. And that's some of the really advanced stuff we've been doing with FHIR and deduplication in our cloud strategy. But Oracle Health Seamless Exchange really looks at all the data that's coming from these sources and finds that it can deduplicate and find just that novel information that's out there that's not already in their record and show that to the clinician in the point of where they're really kind of looking at that information. And I think that's the next wave opportunity. So we really have to get that network and those data sets right so that we can start thinking about how do we really make this useful for clinicians and for patients.
Yeah. With me today at the Oracle Health Collaboration Forum, I'm joined by Philip Loya from Oracle Health. Hey, Phil. How you going?
I'm good. How are you?
Pretty good. Longtime friend of Talking HealthTech, and I'm pretty sure this is the first appearance, which is poor effort on my part after 450-something episodes.
Not your fault.
But look, we're here now, and we're at the Collaboration Forum here in Melbourne, Australia. And just in between sessions now, just while it's a little bit quiet here in the foyer, to catch up, because you did a great presentation to update all the stakeholders here. Maybe you can give a bit more context in terms of you and your role, and then kind of lead into what you've been sharing today.
Sure, absolutely. So my role is principal growth strategist. So I'm not in our IP or engineering organizations. I'm not in our consulting organizations. I'm really looking at areas for growth, and often that means the workflow and the regulatory differences, the things we need to adjust for clients in our region. So I cover everything from India to the Dateline, and it's a huge region. Of course, most of that's where we have local health assets, and most of that comes from the Surier assets. Of course, Australia is the major point, but looking for growth in other areas too, and ensuring that we can meet the needs of our Australian clients worldwide, and trying to stay abreast on some of those, because we need them to be referenceable. We want people to be happy. We want them to use the systems. We want to transform patient care, really. That's really what I'd like to do. I have a personal element in that side, but through that means connections with partners. It means looking at people for fire and smart on fire kind of applications, the regulatory side of things. There's a lot there.
And actually, we should clarify as well, for those that don't know you, when you say the region, like, you've been in Australia a long time, but if they hear the American accent and think, this guy from the US from Oracle Health, but no, it's we're well familiar with the Australian landscape and Asia Pacific as well. And it was interesting in hearing, your presentation today, hearing how some of these capabilities within the Oracle Health platform can then be localized and then fit the needs of the Australian healthcare ecosystem. Tell me about how you really see this opportunity for impact within the system. You mentioned, like, you're big on the patient care side, which is interesting, given that I guess historically, some might think of an EMR or a hospital system as, this is the place of record, but then the patient care happens around the EMR or like for the EMR almost. Like, tell me about this transformative thinking that you've got going on.
Look, I think everybody's been guilty of that, us included, right? There's been people that put in the systems, and the systems have kind of taken over the care, or it becomes the face. And none of us really want that, right? You go to see a doctor, or you go and see a nurse or an allied health clinician. You don't want to be speaking to the back of their laptop or the back of their screen or something like that. That's not great. Like, I see value in some of the things that they have on that screen. Maybe they know my medications or my allergies, or maybe a bit of my history, although oftentimes I get asked that every single time.
This is true.
Right?
Yeah.
So, yes, I'd love them to have some of those pieces. I expect the system to be there to do the bare minimum pieces, but it's become something that's in the way, right? And so I'm really looking at and trying to help on how can we use some of these new tools to take away some of those actions, or just be the second check, right? We start looking at the Australian landscape. Our public hospitals are not necessarily funded on individual services, etc. Yes, there's some fee-for-service pieces, but the element that we want, to the point that some of the others have talked about, is we want to actually code appropriately. But oftentimes we're making the decisions of coding appropriately, of is it worth bothering that clinician, that doctor, 3 weeks after the fact to go update their diagnosis list, assuming they put in a diagnosis. That's actually still a problem, right?
Assumptions, yeah.
So there's a number of challenges there, and that's where I start thinking about a lot of the newer tools, the AI that comes out, and some of the guided prompts. So saying, hey, you have a patient on a diabetic medication, but you haven't put diabetes on their problem. Or the opposite, you've put diabetes there, but yet pathology, they're not on a medication, etc. Is that an element? And then asking even pertinent questions. We have groups that are looking at that. My HACPA, for example, has their little view of, I shouldn't call it little view. They have an app on ICD-10 that looks at the terms in ICD-10 that are too generic, where they want to ask a few more questions, and that may then change your DRG and your funding arrangements. But the problem is the clinicians don't use ICD-10s.
Yeah.
Right? That's not our national terminology for clinical use. Yeah. It is our national terminology for HIM and reporting and use, statutory kind of use. So we just have to kind of think about how we can make some of those connections and use some of those tools, because if I can ask the clinician maybe one question while they have the patient in front of them or while they're thinking about that scenario, that could have a significant impact to the rest of their care, the screens that are shown, the reimbursement model, or some of those kinds of tools. And I haven't had it work for anyone. Yeah. Right? And maybe if I'm listening and proposing some of these things too, we can have a conversation like you and I.
Yeah. I mean, right? Yeah. And in the end, that provides a better experience for the patient in the consultation, and hopefully the retention of the information and the flow through, hopefully to care, it all, and outcomes, that all kind of shines through. One thing that came through from your presentation I noted was that, in this transition of Cerner to Oracle Health that's been happening, and we're starting to see some of those benefits in looking at, you're looking at the product roadmap in particular, and talking about, historically we'd look at, the 5 years down the line, and so talk about a vision, and there's some really cool things that were in that kind of longer term vision, but it's transformed how you're kind of developing, and it sounds like there's, I guess, end customers should expect some faster iterations and developments than they've seen before. Tell me a little bit more about how that's changed.
There's been a culture shock.
Yeah.
That's been the biggest piece, I think. So Oracle being a more purely technology company, not that they're necessarily pure tech, things change so quickly, right? So roadmaps that you plan for this year, you're going to have a few changes along the way, but you're not, yes, you need to think about next year and the year after, et cetera. But, nobody expected ChatGPT to take off in the last year, right? People have been working on GPT models, et cetera, and large language models, including Oracle, for a long time.
Yeah.
But for some reason, it was the right point, the right time, the right interface. Yeah. Although that's questionable now. How many do we really want to chat? Who knows? Let's see.
Sure, yeah.
Right? But nobody expected that. So, 2 or 3 years ago, yes, you made investments thinking that you needed to be thinking about that, but it's totally changed the thought process, right? But the culture shock is that our hospitals and our clinicians, they often move at a little bit slower pace. And a lot of that's to maintain patient safety. It's not that they don't want to move faster. It's that these systems and these organizations and their processes have come up to try and make sure that they're still giving good care, and that they're not jumping to the new medication that then has a surprise side effect that nobody knew about until we got to it. Yeah. A year's worth of using it or something like that. So there are legitimate reasons for thinking in that longer path. And so that's where we've had to find kind of that middle grade.
Yeah.
And so Oracle definitely is making bigger commitments, faster commitments, because it's brought a whole new technology set. Mike Cecilia talked today as the head of kind of our vertical with Oracle Health and a number of other industries of, the value of low code, no code tools. Cerner didn't have those, right? Many of the EMR vendors haven't implemented those because those things kind of evolved over a period of time with the large cloud users, et cetera.
Yeah, when you say EMR, I don't think low code, no code. Those two don't normally go together.
Right? And so then, now they brought this full tool set that Cerner would have eventually figured out, and all of our competitors too would figure out. Everybody's on a cloud transition, but you're learning it when that's not your core competency.
Yeah.
It is so different when I can get on the phone with someone that database, living, breathing database, autonomous, et cetera. That is their core competency. They live and read it every day. You're not just an Oracle trained database administrator, or they are the database administrator, right? And so that changes the tool set that's available, and that changes how quickly we can respond.
Yeah.
And so I'm excited to see how that works. It's also given a second chance to reinvent things.
Hey.
We've had a system that, for the most part, was designed and looked and sounded and probably spoke a bit of American, right? And we put some Aussie little pieces around and sprinkled some fairy dust, and we made it work, right? PBS is there and some of the core elements we need, but at its core, it's still, in one way, an American system trying to be global.
And
now we're working with a company that is very global in hundreds of countries now across various different cultures, languages, etc. They're the ones pushing on and going, we've already lived this lesson.
Yeah.
Don't repeat it. And now we have a chance to relive this and go, okay, knowing all the things we've learned, we'll do better on those, but also start thinking about the regions where we have, right? Healthcare in sub-Saharan Africa should be the same, but it's not the same time, right? And the people there will have the exact same desire and expectations over time to have that too, and that should be what we want. We want improved healthcare.
Yeah. Hey, if I think about, in hearing, I had an idea, but I've learned so much more about how, I'm going to say, pervasive Oracle technology is across everything that we use, just broadly, globally, and how, everyone interacts with it kind of behind the scenes. So, and in the context you've provided as well in terms of, I guess, new era of innovation and, these opportunities ahead. I know full well about, how hands-on and grounded you are in what the reality is on a day-to-day within the Australian healthcare system. So I guess to close out, then thinking about, with all that in mind and the needs that we've got, today in healthcare, where are you seeing the biggest opportunities, or for those public hospitals or the hospital administrators or the nurses working on the front line, what can they kind of expect to see that's going to impact them over the next kind of 6, 12, 24?
I think there's some elements of pieces that we'll control. So there's some elements of the change, some of the new UI pieces that will come out, some new functionality, etc. Those will all be incremental. They still will have major benefits in certain areas and workflows, etc. of those elements. I think the other thing that I'm seeing kind of industry-wide is that we're all kind of coalescing around some standards, and I think that's fantastic. So the Sparks program with its FHIR accelerator, there's several other standards for device connectivity, et cetera, that are around that the ADHA has cataloged and endorsed along the way, and some of the terminologies. These are the things we need because I think we're rapidly all getting to it, and I kind of said it before, we probably can't do everything, right? And when everybody's individual environment, their design, their workflows, et cetera, are all completely different, it's really hard if you are a startup or a niche vendor or something to find the business model to fit in, because you're going door to door, and each time you have to keep changing your code because everybody is not stable. FHIR is going to give us a foundation, right? And that foundation, or that minimum floor that everybody's meeting, and it will have the Australian variant, and there's the US variant, and UK, et cetera. There are variants, and there are legitimate differences, but the core elements are there. Analogy is analogy there. The medication list is a medication list. I think this is going to bring a lot of innovation, right? There's so many people that have really good ideas, and they can start to get a scale as people invest in this foundational floor that maybe FHIR, probably FHIR Plus, over a period of time too, right? But, someone that's, let's take a specialty dermatologist, for example, right? Mm-hmm. They have very specific needs that, a worldwide global EMR provider may not ever get to their specific requirement.
Yeah.
Well, but you could have an application that you created specifically for them. You still need a system of record. Yeah, you still need the APIs, the integrations with its elements. But now we have the concepts where we can, incidentally give everybody a platform where they have a chance to compete.
Yeah.
And then if there's 2 or 3 dermatology APIs or apps, okay, fine. Yeah. Way the best app win, right? Or whatever is the best idea or what people like. They have choice, right? And that's good too. Because even though we're all human, we don't all practice the same way. We don't have the same drivers. The cultural, linguistic elements, now even here in Australia, can vary from suburb to suburb, state to state, et cetera, too.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.